So I just want to go through this setup, what would be a typical kind of wind down, getting ready to go to sleep after a hip arthroscopy in terms of the equipment. So this is our CPM machine here on the side, and this would be on your bed. And then the setup includes the machine that's going to power the calf pumps. These are called the calf pumps. The calf pumps have a wider part on the top and then a thinner part on the bottom. So the wider part goes higher up in the calf, and there's Velcros on the sides to actually just strap it in place. If you notice, the clip here goes on the very bottom. So clips on the bottom, not on the top. Wider part is also on the top. So I'm going to put the second one on here as well onto the right side. So the calf pumps are for both the right and the left sides. And they are to prevent blood clots. So we keep these on overnight. They will squeeze your leg when you turn it on. You can see this is the bottom side. The second part, I'm going to have you stand up, is putting on the compression sleeve. So the compression sleeve goes on the side that the surgery was on. So in this case, we're going to do it for the left side. Basically, the pump part of it goes downward. We wrap this around the hip. It's got a Velcro strap. It's pretty straightforward. Want to make it all snug, so that's one strap. Then the second strap goes around the thigh itself, and it just sticks to this. So this is aiming downward, and now you can actually get in bed. It can be helpful to have someone, family member, kind of get you through it. So I'm going to have you lay flat on your back here with your leg over this way. So then we strap the leg into the CPM machine. There's a strap on the top here, and then there's also a strap that goes into the foot. So we're going to lay the leg in like this and have you slide down just a little bit more. This way the foot is seated well into it. Velcro strap over the foot. Velcro strap over the thigh. These should be snug, and they can be adjusted. And if you notice, we have these points which can then be connected and should be hanging out to the machine. It's pretty obvious. It's color coded, and it just snaps into place. So once you're laying down, you can just snap in entirely, including the calf pumps. There's two calf pumps, so you're snapping both of those in. Then you have the control for the CPM. We start at 30 to 70 degrees. There's a 30 and 70 degree in terms of just setting those angles on the machine, and then you can just hit go. Also importantly, when we look at the measurements of the CPM machine, it is important that the back and that the bed is flat. So if for some reason you use the CPM on something else, make sure that it's a flat surface. The additional guidelines related to the degrees are in the packet, and please refer to those over the 4 weeks that you'll be using the CPM machine. If you have any problems with the machine, please refer to the phone number in your packet to get assistance in terms of getting it fixed. Thanks a lot for your time. I hope this has been helpful to you.